Tonight, we're digging into the fight over Medicaid, one of the country's most popular healthcare programs, and why Republicans are talking about slicing $800 billion from it just as enrollment hits record highs. First, a quick refresher. Medicaid is the joint federal-state program that covers roughly 1 in 4 Americans, low-income adults, kids, pregnant women, many seniors in nursing homes, and people with disabilities. The Affordable Care Act lets states expand eligibility, and 40 have now done so. With that, plus pandemic protections, enrollment has soared to more than 90 million people. Polls show majorities in both parties call the program important or essential. Enter the new budget battle. House Republican leaders are assembling a sweeping package privately dubbed the Mega Bill, designed to extend the 2017 Trump tax cuts before they expire. To pay for that extension, the bill eyes roughly $800 billion in federal savings from Medicaid over the next decade. The main idea is to replace today's open-ended federal match with either block grants or per capita caps. Washington would send each state a fixed sum, sober, conclusive, and let state lawmakers decide how to stretch it. Supporters say caps would finally put Medicaid on a sustainable path and give states flexibility to innovate. Critics hear something very different, a slow squeeze that forces states to limit enrollment, cut benefits, or slash payments to doctors and hospitals. Because federal support would no longer rise automatically with costs, any economic downturn, disease outbreak, or expensive new treatment could blow a hole in state budgets. Strategic, smelling a political opening, are ready to defend the program. They're calling the Republican plan a big, beautiful bill in a jab at former President Trump, arguing it trades health care for working families to finance tax breaks for corporations and the wealthy. Party strategists believe forcing a vote on Medicaid cuts could hurt Republicans in suburban and swing districts, where the program pays nursing home bills or helps children with special needs. Beyond the politics lies the human math. A study by the Center for American Progress estimates cuts of this scale could lead to more than 16,000 additional deaths each year as people lose coverage and skip critical care. Other analyses warn of tens of thousands of preventable deaths over a decade, along with higher medical death and closed rural hospitals. Yet Medicaid's expansion continues, even in red states. Voters in Idaho, Missouri, Nebraska, Oklahoma, and South Dakota approved ballot measures to broaden eligibility. In North Carolina, a Republican-controlled legislature passed expansion last year after pressure from hospitals and county sheriffs who said uninsured residents were straining local budgets. These moves highlight a growing gap between national GOP rhetoric and state-level pragmatism. So what happens next? The House could fold Medicaid caps into a larger tax and spending bill later this year. The Senate is unlikely to accept those terms, but the proposal will shape negotiations over the federal budget and, ultimately, the 2024 campaign trail. Expect ads featuring moms, seniors, and veterans who rely on Medicaid, alongside warnings about debt and deficits. At its core, this fight is about two competing visions. Should government guarantee a broad safety net, even if it means higher spending, or should it pare back commitments to cut taxes and limit Washington's reach? The answer will affect tens of millions of Americans, whether they ever set foot in a doctor's office or not. We'll keep tracking every twist. For now, remember, behind the numbers are real people. The choices in Congress could determine who gets care, who pays the bill, grave, somber, cautionary, and who is left out when the next crisis hits.